Well, as you start to look around, you start to think about big data. You guys hearing a lot about big data these days. It's a real buzzword. It's like cloud, right? Nobody really knows what it is. It's a cloud. Big data, nobody really knows what it is. It's big data. Well, it's true. We do know what it is. We know what it means, and everybody uses it differently. So it's not really a great term of art in health information technology necessarily. Instead, let's think about where we find data and how it's coming to us and what it means to us and what we'd want to do with it if it was a perfect world, right? So big data folks talk about variety. And there's no question we've got variety going on. You've got electronic health record systems, EHR systems, image systems, and everybody's systems of systems of systems. We're just down the rabbit hole with data, right? A wide variety. And we can talk about standards and interoperability, HL7, and all these things too, which is fantastic. And these are great steps. But the truth of the matter is, it's data of a wide variety, right? And then you have volume, which is copious amounts of data. I work on the payer side, and we get every claim for every member in every state that we have a Medicaid health plan. That's an enormous amount of data. And it comes to us as administrative information. Well, what would you do with that if you had that volume of data on your patients, right? If you could partner with a payer, what would you do with what we know about your membership? It's an interesting question, isn't it? And then you talk about velocity. Velocity is one of those things, I think you see these in, like, when you travel in airports and you see these business billboards, and IBM's always talking about the speed of business and velocity. And this is an important point, though. The reality is the velocity of data really matters. And one of the things the payer organizations have missed up until recently is that everything they have is claims data, and it's all lagged. It's all old. And everybody in here who's a clinician is going, it's not clinically actionable, right? It's not clinically actionable when I have lagged data, which may or may not be true, but that drives us to the next point, which is it's really about context. Data is all about providing context. It's putting data together in a way that is purposeful and thoughtful and actionable. Because when you talk about big data, you end up doing something like this, which is just an illustration. We don't want this. We don't want to treat people through machine learning and big data applications and big Hadoop environments to just say X equals Y, so Y equals Z, and so that should happen over there at the point of care. Tell someone to do Z. This is my personal concern for big data in healthcare, which is that it's going to depersonalize the actual process that happens at the point of care. So we have to watch that. So we have to keep data in mind as something that could be curated,